wanted to discuss with you was just talking about your medical history. We've reviewed that previously, and I've noted that you're not taking any medications. But we did note that you had high blood pressure whenever you came into the clinic initially. We've been monitoring that for several appointments, and it's actually come down to just slightly elevated the majority of the time, so that's fantastic. Initially, we did recommend that you see your practitioner just to get that checked on, but it sounds like your stress has gone down some too, so that's fantastic. I also want to review your dental history, and more than anything, your chief complaint just being the overall health of your teeth. I know that that's a very big concern for you. And then also, you let me know that you brush about 3 times a day, which is about 21 times a week, and you floss about 4 times a day or 28 times a week. Would you say that's still pretty consistent with what you're doing now?
Well, now I actually start brushing often.
Okay. So whenever you're brushing, did you feel like, because for 3 times a day, was it just like kind of like giving you little areas that needed focus, or were you doing like the full brush of all of your teeth that many times a day?
Areas that needed focus.
Gotcha. And that makes sense, because whenever we eat or whatever, stuff gets into little spots. As we discussed previously, we talked about your periodontal status. And so we've graded you as periodontitis, stage 1, grade A. And I have a little pamphlet that I can share with you. Stage 1 is mild periodontitis, and it's anything that is equal to or less than 4 millimeter pockets. And we noticed that we had some localized 4 millimeter pockets whenever we did those probing depths. You do have mostly horizontal bone loss. So there's horizontal bone loss and there's vertical bone loss. And as you can see in x-rays, the vertical bone loss is going to be stuff that's angling down, just more vertical. Horizontal, whenever it just comes flat, like that. And the horizontal bone loss is less concerning than vertical, and that's what we're seeing right now, so mild periodontitis. Our treatment recommendations are periodontal debridement. SRP stands for scaling and root cleaning, and that's what we'll be doing on your teeth whenever we get to our cleaning. And then we're also going to recommend that you just have comprehensive at-home oral care regimen, which it sounds like you're on top of things already, but then hopefully some of the tips I give you can continue to help you know what to do at home. We're noting that this is a slow progression. So you're not a smoker, which is fantastic, and so that's what makes you a grade A. Because there's periodontitis, there's multiple stages, and then there's grades, A, B, and C. We noted in your x-rays, we know that you have one tooth that does need to be addressed by a dentist. And as we talked about, it sounds like you're going to the dental clinic in Alabama to get that taken care of. But aside from that, number 19 and number 30. So those were things that my instructor just thought were suspicious areas. So number 19 on this is going to be that first molar on your bottom left. And I believe you already have a restoration there, and that's one that needs to be fixed. And then the other one is 30, so on this other side, and you know that one needs to be fixed. I think that was the other one that we talked about that has, if you'll open for me really quick. Yeah, so that one's the compromised filling, and actually I think that's kind of the situation with both of them. They're compromised amalgam fillings, but whenever you go to get your dental assessment, they'll take care of those.
Those are the true immediate.
Yes, yeah, that's what we recommend. As I mentioned before, our objectives for our time together today really is to focus on brushing habits, and also I really want to share with you how to use some interdental aids for those areas where you have gaps. And what we call gaps, if you might see it, I have a process of care plan, that blue sheet that you'll take home, and it might say diastema, and a diastema is a gap. And so in those areas, we'll talk today about using an interdental brush to get in between there, because the toothbrush just can't quite angle back like you want it to. So we have some additional resources for you. What I would like to do next is plaque index on you. I'm going to pause our video for a minute, do a plaque index, and then we'll come back and then we'll evaluate, look in the mirror, and see what we have going from there. Yeah, so we have applied the disclosing solution, and so you're seeing the pink on your teeth. So will you smile for me? Okay, so I'm seeing it kind of at the gum line, and then we're seeing it in the front there too. What do you think about our findings?
Crazy.
Yeah. Well, and I know, as you've said, you're an avid brusher, and so it may just be your technique and how you're brushing. And so that's what we'll talk about today, to really help you get, especially at the gum line and in between those areas, because you have some teeth that are out of alignment, and those can be really difficult to get in between. So flossing properly can help, using the right kind of floss, and then also, like I said, just using the right brushing method too. So first, will you show me how you're currently brushing your teeth at home with this guy?
then I try to go on top.
Gotcha.
Much as I can.
Yeah. So the top, that's a good method. Were you gonna say something else?
Yeah, and then I do the same thing. I try to do the same thing inside also.
Okay. Very good. Do you brush your tongue?
I believe it.
Okay, and that's fantastic too, because that's a great place to collect bacteria. So that's really good you do that.
And I do have a question about the tongue when we get to that.
We can go ahead if you want.
Sometimes the hard part about the tongue doing that is the gag.
Yes.
So
Yeah.
is that in general?
It is. I wish that I had a better technique. That's me every morning. I am a bad gagger too. And I wish that I had some, I mean, maybe you can distract yourself. You know, sometimes we're like, shake your leg or you know, things like that. Or just be careful. You don't have to go so far back there. You don't want to hurt yourself. But they also make tongue scrapers. Have you ever seen those?
I've heard of those. I don't think I've ever seen them.
So it's another really good device. I don't know if I have any, but basically you use it and instead of the brushes, you put it in the way back and you scrape forward. So you're scraping the bacteria forward and then you rinse it off and you can get it out of your mouth. And so those are pretty handy, but I'll check my supplies and I'll see if we have something like that. Maybe we can send you home with one of those. But you're doing a good job getting these facial surfaces, like you were saying, going along, like just all around the perimeter. But what I would recommend is I feel like you can focus your efforts a little bit more at the gum line though, potentially. So instead of just going like a 90-degree angle, you're gonna wanna angle it at a 45-degree angle. And you can do little circles as you go along. So that's gonna help a lot getting all of those in between areas. Also, you wanna go like this. This is how you're gonna really brush those front teeth good and get this back side. And so the same with the top, is just doing it kind of like that method. So that helps. Whenever I was talking about the little circles, that's called the modified Bass method. You don't need to remember that, just as long as you remember the technique. But that's what's going to be on your patient treatment plan that we have. It'll say modified Bass method, and it's just talking about those little circles at a 45-degree angle on your gum. Whenever it comes to these parts of your teeth, you're doing a good job. That's basically the gist of it. You just brush them like you brush them. And then just be careful with your tongue. You know, that gag reflex is real, but just pulling that bacteria up, that's the biggest thing. You don't want to push it back, just pull it up and get it out of your mouth. Now, when it comes to flossing, what you'll see on your treatment plan is something called the C method. And so, will you show me currently what you would do?
Back and forth.
Okay.
And then when I try to do the other side, we get back and forth.
Yes. Another thing that I like to do is wrap it around my fingers. You do have to be careful not to cut off your circulation. But, so are you right-handed or left-handed?
Right-handed.
Okay, perfect. So am I. So what I do is I'll wrap it just a few times around my left hand, but my dominant hand, I wrap it all the times because you want to move the floss as you go along the teeth. So you're going to use your pointer fingers. That's going to help you really get way back there whenever you're wanting to get these back areas. But so you're going to be real careful, just sawing motion back and forth until you hear that click. Then the C method comes into play whenever you go whoop, 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 just like that. You're going to just scrape the sides like 3 times, and that's how you do it. And then you move the floss and go to the next area. We move the floss because we don't want to spread the bacteria around in our mouth. So that's what the floss picks that people have. Those are good, but I feel like they do spread bacteria. So that's what's nice about the string floss. I feel like you have better access. You're going to curve it around a lot easier than something that wasn't modified by your fingers.
It's not just like removing the food that's
It's not, yeah.
taking rid of the
Yes.
bacteria.
Yes, and I'm glad you mentioned that. So speaking of the bacteria, you eat a snack or food or anything, a carbohydrate, there's bacteria naturally in your mouth and it basically eats the carbohydrate too. And so what happens, just like we excrete food, the bacteria will excrete acid. And so the acid is what will eat through your enamel and cause you to have a cavity. So that plaque, that's why it's really important. It's not just about getting the food out from in between your teeth, but you want to remove as much plaque as possible. There's harder buildup called tartar or calculus, and tartar, you really can't remove it on your own. That's why people come to the dentist oftentimes to get that removed, because our special instruments can remove it a lot easier. But that's not pathological, it's not dangerous, but it's a breeding ground for bacteria basically. So it's like it's sticky and grainy, and so it's where the bacteria go and have a party. So that's why we want to remove it, so that we disrupt any inflammation that can take place from the bacteria. Do you have any questions about that, or does that make pretty good sense? So these are inner dental cleaners. They're little brushes that we have. And I have another pack. I'll demonstrate with these, but I'll let you take some home. And I'll also let you take this guy home with you too. So this is what's gonna help. But those diastemas, or the gaps that are hard to get to, you can put one of these in and you can get in between those hard to reach areas. So let's just say, imagining your mouth, we know that I think you're missing a tooth here and here. And so in those areas, that's where you're gonna wanna really get back in there. Yep, just like that. And so it'll help get those in-between areas. And also, the floss that I had is actually expanding floss. And so in the gaps, whenever you use it, it'll puff up and it'll help you get that hard to reach food out easier too. So in tighter areas, we're gonna use tape floss, but in the areas that have bigger gaps, we're gonna use the expanding floss. And then you can use this. So just be careful with where you use it, because it is specified for certain areas. I wanted to discuss with you though, we're gonna be potentially using a soft manual toothbrush. So what are you currently using for your toothbrush? Do you know, is it a manual toothbrush or is it electric?
Manual.
Okay, so soft manual would work great. I think what will help you a lot though is using an electric toothbrush. Yes, because it does the work for you. So you wanna look for an electric toothbrush that has a charging cord, and you also want it to have a timer. Those are two really important things on there. A timer. So a timer, yeah. So how it works is you have 4 quadrants in your mouth, and it'll do 30 seconds, 30 seconds, 30 seconds, 30 seconds. And so because you want to brush your mouth for 2 minutes. So that timer just kind of helps you keep track of where you're at, and then it kind of clicks, and then you know, okay, move to the next side, and you do all of those to you. So you use the same type method that I was talking about with our Typodont that we had. With the electric toothbrush, the main thing, you're gonna just angle it at the 45-degree angle, it does online, and it'll do the technique. I know I bought a toothbrush, I think it was maybe 35 or 40 bucks. It might even be a little bit cheaper than that at Walmart. I love the Oral-B brand, that's my favorite, just because I feel like it doesn't vibrate your face off. Whereas like the Philips, there's Philips Sonicare, also a good brand, but it's pretty intense. So it just depends on your preference. There's not a right or wrong, it's just everybody's different. And then when it comes to toothpaste, I'm gonna recommend the Sensodyne Clean Mint. This is what I use, it's my favorite toothpaste. It really helps with enamel, it helps with strengthening that outer layer of your teeth. It also tastes good, and I think that that's part of it. Like if something tastes good, then you're gonna be more willing to use it, I feel like. I'm also recommending the Listerine Clinical Solutions Enamel Strength Mouth Rinse. And I think that that's going to continue to help with any decalcification that we're seeing in your mouth. And also just whenever you have the areas that potentially need to be restored by the dentist, that's going to help with that too. And do you have any other questions about anything we talked about today?
No, I'm good. Can I take a picture of where I can get in my phone?
Absolutely, no. And if you do have any questions, just text me and I can clarify anything that you might be concerned about. But that sounds good. And so, Ignacio, I guess the one last thing I want to leave us with is just referring back to your periodontal stage. So, because it is stage 1, grade A, you're at the beginning stages. For the 4mm pockets that we saw, it was some inflammation. But the good news is that's still reversible. So, I think that as you implement these aids, and as you use the toothpaste and you continue your habits, but then work on your angulation, I think it's really going to improve in your periodontal status. I think you can go back to a healthier periodontium, which is healthier gums, healthier teeth. So that's the truth.
Now that I know what to look for.